Okay, well, good morning, everybody. Thank you for joining. Thank you. I want to thank everybody for joining our Career Update webinar. We had a fantastic AEP, so we're going to see what's new with our carriers and what kinds of things we can do to generate business all year long. And our first speaker today is Emily Ladon with WellCare. Emily, if you want to take it away.
Awesome. Thank you, Pat, and thank you guys so much for having WellCare here today. I'm going to take you through just a brief presentation on, so again, my name is Emily Lalonde. I am one of the regional agency managers for WellCare here in Michigan. This here is our full sales team, so just to give you guys an introduction to our team here in Michigan. Up top, we have our sales leaders, so Patrick Lima and Charles Wolfert. They are respectively our VP of Sales and then our Senior Sales Director for Michigan, Ohio, and Indiana. So if you work in any of those other markets, you might see Charles's name pop up for those markets as well. But myself and Jamie Castelloot are the regional agency managers, so we are your points of contact for anything WellCare in the state of Michigan. You have both our email addresses and our phone numbers up there. Just to note, we did recently in the last 2 weeks have an email address change. So if you do have our contact information saved, just take note of our new addresses there. Anything that you send to our old email addresses will still filter to us, but eventually we will have to get all of those contacts updated with you guys. So that is our new email address up on the screen. Under our names, you will see Catherine Smith and Rick Howard. They are part of our community outreach team, which is a really unique team for WellCare. It can be a huge asset to you guys as well. So essentially their role with us is to be kind of the feet on the ground when it comes to marketing events in the community. Rick Howard is our community relations specialist. He covers Michigan, Illinois, and Wisconsin. So he has a pretty vast territory, but he spends a lot of time here in Michigan. He is willing to go out with brokers one-on-one and do some prospecting to get some new marketing events on the books. He's a great resource. He came to us from Oak Street Health on their community outreach team. So he has a lot of experience doing what he does, and he's pretty good at it. So if you're ever interested in kind of growing that grassroots effort or those grassroots marketing events, which is really key when you are working with the DSNP community, which we'll talk about in a couple minutes here, Rick is a great resource. Feel free to reach out to Jamie or I or Rick directly, and we can help you guys get set up with some time with Rick. But that is our team here in Michigan. Moving on, I just wanted to touch on open enrollment, the period that we're currently in, and just some key highlights about open enrollment for you guys to keep in mind. So first up, what is MAOEP, or the open enrollment period? So this is the enrollment period that runs from January 1st to March 31st. It's a one-time opportunity for beneficiaries who have been previously enrolled in a Medicare Advantage plan to make a change to their health plan. Anytime they make a change, it is going to become effective the following month. So, for example, if they made a change today, their plan would become effective March 1st. Keep in mind that this enrollment period is only open to folks who have already enrolled in an MA plan as of January 1st. So if you had a member that was rolling over into an MA plan, or they enrolled into a new MA plan for a January 1st effective date, they can utilize this open enrollment SEP. Again, it's a one-time only, so once they use that SEP, they don't have that opportunity to make a change any further. And speaking about what changes they can make, so they can change to another MA plan. So if they wanted to go from, for example, one WellCare plan to another, they could do that. They could go to an MA plan with or without drug coverage. So if they were in an MA only currently, they could also move to an MAPD, or they could go back to original Medicare and just enroll in a PDP plan. Again, any changes that a member submits with the open enrollment SEP will become effective the following month. Another important topic to talk about when we're talking about OEP is what you guys can do as brokers. So what are the CMS marketing guidelines for you guys when it comes to OEP? Because this is going to be quite different than the annual enrollment period or AEP. So it's easier to kind of talk about what you can't do because there's a lot of rules around that. So looking at what brokers cannot do during open enrollment period. First up, you can't conduct marketing activities that use OEP as a means to gain new beneficiaries or sales. So Kind of going hand in hand with the next ones, you can't send out mailers or have marketing events that are advertising or referencing OEP as a means to gain new members. So no email, print, or other marketing materials encouraging beneficiaries to change their plan if they were previously enrolled in an MA plan. Furthermore, you cannot buy mailing lists or gain access to personal information with the intention of targeting those beneficiaries who enrolled during AEP. So essentially, the rule of thumb here is you can't target beneficiaries who previously enrolled in an MA plan during the annual enrollment period. What you can do, though, is send marketing materials to beneficiaries who have requested information. So if you have folks reaching out to you asking about OEP, you can definitely follow up with them, schedule an appointment, meet with those members, send them information because they have requested it directly. You can also just target some of your other SEPs, so target agents who are in their initial enrollment period, and you can target other beneficiaries that have an additional SEP. So whether they have LIS and Medicaid, if they recently moved, if they had a change in Medicaid, those are all special enrollment periods that you can target without specifically referencing OEP. And then last but not least, you can also promote 5-star plans. As we all know, that is a continuous SEP for 5-star plans. So essentially, OEP is a great opportunity for you to help members who do need to make a change to that health plan, but we cannot use it as a means of marketing to gain new membership. So that's just a quick high-level overview of the open enrollment period. But what I really want to do today is kind of reintroduce you guys to our decent products for WellCare here in Michigan. We have really strong, decent products in our service area. Before I drill down into just those decent products, though, just wanted to give you guys a reminder of our overall footprint here in Michigan and what our product portfolio currently looks like. So this here is our service area. As of January 2023, we did expand into 24 new counties. Those new counties are seen up here in the light teal color. Any of our existing counties from the 2022 plan year are in the dark blue color. So you can see we've expanded up north, we've expanded a little bit into central Michigan, into the thumb. So we've really added a lot of counties to our service area for 2023. The great thing about that is our entire product portfolio is available across all 48 counties. So we have these 9 products up here on the MA side, and all of these products are going to be available in all 48 counties that we serve. As I mentioned, I'm just going to talk about our decent products today, but up here on this slide, you can see our full product portfolio, and furthermore, you can see what we consider to be our push plans in the Michigan market. So these are the plans that we feel are best positioned for you guys as brokers to succeed with WellCare in our service area. So that will include the WellCare Assist HMO. That's an LIS non-special needs plan. We have both of our decent plans, so the dual access HMO POS and then the dual access open PPO DSNP. Our WellCare no premium open PPO, which is a $0 premium PPO, and then our WellCare Patriot Give Back open PPO, which is an MA only give back plan. Just a note about all of our PPO plans, they are all fully passive, so fully medically passive. So whether that member is going in or out of network, they're going to have the same cost shares. As I mentioned, though, we're just going to talk about the dual access and dual access open today. Before I get into the specific benefits on these plans, I just wanted to talk about some supplementary benefit updates to both of these. One of the biggest ones being our DSNP Healthy Foods card. So new this year, we are utilizing the VBID, or value-based insurance design model, to implement our healthy food card and then also $0 prescription drug costs for our DSNP members. So I'll talk about the second part in a couple slides, but just looking at our DSNP healthy food card. So this is a huge benefit to members. In 2022, our food benefit was tied to our SSBCI model, which meant that members had to qualify to receive that food benefit. The great thing about this benefit for WellCare for 2023 is that there is no qualification process. They are automatically going to receive that $25 per month prepaid debit card that they can use to purchase healthy foods in store or online. Our vendor for this benefit is a vendor called Incom, and I just want to address that really quick. So Over here on the right-hand side of the screen, you can see a copy of what this debit card will look like for members. This has caused a little bit of confusion because Income is also an OTC provider, and their logo is the OTC network logo that you see in the bottom right-hand corner of this card. Just know if you have any WellCare members currently or in the future that ask you about this card, this is solely to buy healthy foods. We do have a separate OTC benefit, which I'll talk about when we get to the benefit slides. But this card here is just for healthy foods, even though it says OTC network on it. So I understand that can be a little confusing. So if you guys have any questions in the future on that, just feel free to reach out to us and we can help guide you and your members through that. But this healthy food card, as I mentioned, is $25 a month. It does not roll over from month to month, so members will have to utilize that full benefit within that given month. And the funds are going to be applied right at the beginning of the month, so they can use that right away. They do have to activate this card or activate this benefit, which is pretty simple process. They can either call in through an IVR system, or they can create an account online where they can view their balances and view their transactions that they complete with this card. But once they go through that activation process, they will be able to use this month after month at our participating retailers. This benefit is a national benefit, so it's a national vendor, and our WellCare plans across other markets and other states also utilize this Income vendor. I bring that up because we have solely national retailers for this this benefit. So you can see those participating retailers down on the last bullet point, but that will include CVS, Dollar General, Family Dollar, Kroger, Rite Aid, Walgreens, and Walmart. So those are all national chains, hence why they are our participating retailers for this benefit. There are some other small vendors that are contracted in the state. The most notable one is Eastern Market. So if you have members who live in the Detroit area, they can actually go to Eastern Market and utilize this card with any vendors that are able to accept a debit card. So most of the time though, they will be able to go to those large national retailers. Okay, next up is our special supplementary benefits for the chronically ill, or SSBCI. So these are a special subset of benefits that we offer that are designed to help members specifically with chronic illnesses to improve their overall health. On our 2023 DSNP plans, this is going to include our utility flex card allotment, as well as our unlimited non-medical transportation benefit. The flex card benefit is a $50 additional balance that is added to a member's pre-existing flex card that they can use to help pay for their utility bills, such as water, electric, gas, phone, internet, and they get $50 a month, similar to the food card that is month by month. It does not roll over, and they would have to utilize that within the whole, or within that given month. But this is a really easy benefit to use once the member does qualify. They have their one WellCare Flex card that they can use for several different benefits. And this allotment will be added directly onto that Flex card. The unlimited non-medical transportation, this is, again, unlimited, which is a huge benefit for our DSNP members. And this is going to help them get to places that are non-health related, non-medical related, but places that are within their community that they might have a harder time getting to due to transportation access. So this will take them to a grocery store, the post office, a gym, church or places of worship, the barber shop. So it can take them to all of those unique or non-medical locations that they may otherwise have a hard time accessing due to access to transportation. Now, to get access to both of these benefits, again, a member does have to qualify. So looking at our new qualification processes for 2023, a member would have to meet the criteria listed up here on this slide. There are 3 different criteria they must meet. The first being that the member must require intensive care management. Furthermore, they must have had 2 or more inpatient admissions in the last 60 days, or 3 or more emergency room visits in the past 60 days. They must also be at high risk for future hospitalization. So being assessed as being at high risk for that unplanned hospitalization within the next 60 days. Last but not least, they also have to have a qualifying chronic health condition. Our list of chronic health conditions has not changed for 2023. We still have about 49 conditions that do qualify a member for this benefit. So I will share those with you guys on the next slide. I also want to note, though, that the process for submitting these attestations has been updated and improved for 2023. Previously in 2022, we had members with a lot of issues calling into member services or routing to the correct team to get this attestation submitted. Good news this year is that it's all done through an online portal with the member's provider. So once the member has that conversation with their provider can go right to the portal listed on this slide, which is ssbci.rrd.com, and submit that attestation online. It also helps cut down on the processing time because we're not having to fax and receive that letter of attestation. So once that provider submits the attestation on the portal, the member will have a determination within 10 business days on whether or not they're going to be approved for that flex card allotment and the non-medical transportation. And then last but not least, these here are the qualifying conditions for the SSBCI benefit. So I'm not going to read through all of these here, but you can see that there's quite a few on here, quite a few different categories and different chronic conditions under each category that could qualify a member for this benefit. So diving into our product offerings on the DSNP side for WellCare. First up is the WellCare Dual Access Plan. This is our HMO POS DSNP plan. This plan has been around for several years. If you've been selling WellCare for a while, you're likely dating back to the Meridian Care days. You're also probably somewhat familiar with this plan. This used to be our Extra Plus plan, and it's been around for probably the past 5 or 6 years. Over that time, it just continues to grow and grow and grow from a benefit perspective. So looking at the benefits here, obviously being that it is a fully or a decent plan, the member is going to be fully cost share protected. So if we just look at the supplementary benefits offered on this plan, first and foremost, the member is going to get 24 one-way trips in transportation. That's medical transportation. That's also going to be through our Motive Care vendor. They get their standard gym membership. On the dental side, though, this plan is going to offer no maximum allowance on comprehensive and preventative dental services. So just to explain a little bit about what that means, essentially the member is not capped to an amount or an allowance per year on their dental benefits. So if they need to get a couple bridges, a couple crowns in one plan year, they can because they don't have that dollar amount that they're capped to. This dental plan will also cover dentures, and it is the only plan we currently offer that offers implants as well. Now, when it comes to the dental benefits, members still do have to stay within benefit limitations. So, for example, we're not going to cover 5 new pairs of dentures in a given year, but a member can get those multiple dental services without having to worry about staying within their dental cap per year. I do also want to note that implants will require a prior authorization. So I encourage members who are looking to get an implant to start working with their dentist to get that authorization submitted so that they can access those implant services. But this is a great benefit. I mean, our decent members typically do need a lot of dental care, and this really does not limit them in being able to access that care in any given plan year. On the vision side, members have a $300 allowance towards eyewear, and then for their hearing benefits, they're going to have $1,500 per year, so a total of $3,000 to utilize towards their hearing benefits. Furthermore, this plan is going to provide members with a $1,500 flex card for extended dental, vision, and hearing coverage. I've talked about our flex card a little bit with the utility benefit, but if you're not familiar with our WellCare flex card, this is a prepaid Visa debit card that the member is sent in addition to their ID card and their healthy food debit card that allows that member to extend their dental, vision, and hearing coverage. It's going to extend that coverage in a couple different ways. So members can use this to pay for services beyond what's allowed on the plan. So for example, if they wanted to buy a pair of glasses that was over $300, they could use their flex card to make up for that difference. It can also be utilized to cover things that aren't traditionally covered on the plan. So if a member needed to, I typically use implants as an example for this, but it is covered on this plan, so it's a bad example in this sense. But if they needed to pay to go out of network, if they wanted to see an out of network dentist or eye doctor, they could also use it to pay for that. Reason being is that this flex card works solely off of merchant category codes, which are codes associated with the provider's point of sale system. So as long as that provider has a dental, vision, or hearing merchant category code, the member can use this card at that provider. Again, really helps the member extend their coverage and have full autonomy over their dental, vision, and hearing health, for the 2023 plan year. So that's a great benefit. One thing I do want to note about the Flex card is that it does have a separate purse of $250 for vision services specifically. So $250 will be allocated towards vision, and then the remaining $1,250 can be allocated towards additional dental and hearing services. Furthermore, as we already discussed, this plan is going to come with a $25 healthy food debit card, and then it's also going to have $405 out of our over-the-counter catalog per quarter. Our over-the-counter benefits are through CVS, so members can order over the phone, they can order online, or they can go into some select CVS locations and order or purchase their OTC benefits directly in store. To do so, they just need their member ID card. That is all that is required to access their OTC benefit. As I mentioned, our Decent plans also have $0 prescription drug copays for all tier levels in 2023. So that is an added huge benefit for our Decent members. If we just look at the added benefits for members on this plan, so between the $1,500 Flex card, the $25 healthy food debit card, $405 per quarter out of the OTC, and then if a member also qualified for their SSBCI benefits, that would put them at upwards of over $4,000 a year that they're getting back in their pocket from these benefits. So again, that is a huge benefit to our Decent members and a huge opportunity for them to get the healthcare they need and also save some money throughout the year. Now, just to note, this is an HMO POS plan, so members would have to have most of their providers in network in our WellCare network of doctors. If they did not, however, we do also have our PPO Decent. So again, this is a Decent plan that members can see in and out of network providers at without any additional cost to them. So they are still fully cost share protected, so they're going to have those $0 copays across the board here. Looking at the supplementary benefits for this plan, they're also going to get 24 one-way trips and transportation. On the dental side, they're going to have a $4,000 allowance towards dental. They will also be able to get dentures, but implants are not covered on this plan. They'll have $400 towards eyewear and then $1,000 per ear per year towards hearing. They're also going to have a $1,000 Flex card for that extended dental, vision, and hearing coverage. So again, that will have $250 towards vision, and then the remaining $750 on that Flex card can be utilized towards dental and hearing. They're also getting the $25 healthy food card, the $0 prescription drugs, and then they'll have $370 per quarter to utilize out of our OTC catalog. Balancing up those amounts, similar to how we did for the HMO POS plan, that's still going to put them over $3,000 back in their pocket per year. The benefit of this plan is that they have that network flexibility. So if they want strong dental benefits, if they want a Flex card benefit, and they have out-of-network providers, they can still access that with the dual access open plan. So between our two Decent products, there really is an option for anyone, especially if they're looking, again, for those high dental benefits. We offer a lot of coverage for those members from a dental perspective. Real quick, because I think I'm running short on time, I just wanted to run through a couple updates for you guys from a broker experience standpoint. First up is our broker portal. If you're not familiar with Centene Workbench, please feel free to connect with me if you'd like to. I can walk you through your broker portal. This gives you access to your book of business, your application status tool, so you can track any applications you submit with WellCare, as well as your commission statements, payment history, all that good stuff. It also has a really great self-functioning ticket system. So if you need to submit any tickets directly to broker support, you're able to do that directly through the Workbench portal. Ascend is our preferred enrollment method. This is available to anyone who's contracted with WellCare, so you can submit electronic applications directly through Ascend. Again, if you have any questions on Ascend, please feel free to reach out, and we'd be happy to walk you through that as well. I did want to take a moment to talk about our value-based enrollment. So, or VBEs, you might also be familiar with the Health Risk Assessment or HRA acronym. They're all interchangeable here, but our VBEs do have a $225 administrative payment for each decent VBE that you complete. So in the essence of talking about our decent plans, I wanted to make sure to point that out to you guys, because that is a great opportunity for you to make some additional income on writing those decent members. So every time you complete a VBE with a decent member, you will get that additional $225 payment for that VBE. The VBE itself is a 20-question questionnaire. It can maybe take 5 to 10 minutes for you to complete after completing an application with a member. A lot of these questions are going to be questions that already come up while you're having conversations with your clients and your beneficiary. So it's really a quick and easy step for you to get that extra payment on each DSNP enrollment. Just to note, if you are submitting non-DSNP enrollments, so any of our other products, you will still get a $75 payout for those CBE assessments as well. This can be done directly through Ascend. If you're not utilizing Ascend as your preferred enrollment option, we do also have a standalone site that you can navigate to make sure that you're still capturing those administrative payments for completing those CBEs. So I will be sure to get that out to you guys if you are interested in learning more about that. Last but not least, these are just some broker resources for you guys. I'll make sure that Pat has these so you guys can jot these numbers down or save them. But just some different support lines that are available to you guys between broker support, our RFI line, SPOP, where you can call to check eligibility for decent members. That is an important point to make really quick. Please call SPOP if you are enrolling clients in a WellCare decent plan. They are able to provide the most accurate eligibility for our decent members. So SPOP is a great resource to have. And then last but not least, our telephonic scope of appointment line, and then our fax numbers for paper submissions. One last reminder, we do have some other webinar series that the WellCare team is putting on for different training topics. We've covered our product review, a deep dive on our healthy food card. We'll be talking about Centene Workbench, Ascend, and some of those other platforms coming up on some of the future dates. So if you need an invite to that, please feel free to reach out as well. But other than that, that is all I have for you guys. So I do appreciate your time, and I will pass it back to you, Pat.
Thank you so much, Emily. Can everyone hear me? Yes, okay. Well, thank you so much, Emily. We appreciate that. And I'm not sure if I introduced myself. My name is Pat Braggs, and I am with IAD, and I am the broker manager for Southeastern Michigan, Ohio, and Florida. So if we want to have our next speakers get prepared for Molina Healthcare, will you guys be sharing a presentation?
Yes, we will. Can everyone hear me?
Yes,
Okay.
we can hear you.
Okay, good. All right.
So we have Javon and Jonathan with Molina Healthcare, and they will be presenting here soon. So thank you for joining us today.
Morning, everybody.
Good morning.
Good morning, Jonathan. How are you?
I'm not sure why my name shows up as Jonathan.
That's okay.
That happens every time. Okay, so yes, my name is Javon Jackson. I'm with Molina Healthcare, and I'm on with Jonathan Roldan. We both are broker channel managers here in the state of Michigan. I handle all of West Michigan. So pretty much if you split it down the middle, I've got the west side of the state from pretty much the bridge all the way down to Indiana. So, and Jonathan has the Detroit area. And yeah, we'll just talk about some of the things that Molina has as far as offerings this year. As you all know, probably, Molina is always focused on the underserved and the oftentimes overlooked in the community. And so the DSNP population is pretty much what Molina has had as its focal point since the very beginning, 1980, when Dr. David Molina, as an emergency room doctor, was seeing clients come in for non-emergent situations. And we all know what happens when you do that. Big bills that you can't afford. And so he decided to start his own practice and to see those folks that didn't have a primary care doctor. And so from that point until now, that's been really the focal point of Molina Healthcare, is looking after those individuals who oftentimes don't have good health outcomes just because of being sometimes overlooked and in other ways disadvantaged. So if you look at our first slide here about Molina, our mission: we improve the health and lives of our members by delivering high quality healthcare. That's our goal. We want good health outcomes rather for all of our members. And our vision: distinguish ourselves as the low cost, most effective and reliable health plan delivering government sponsored care. And our values, you see there listed. So really, we just want great health outcomes for our members, and we've been delivering that. And in our community, really in the state of Michigan, I've been with Molina for 8 years. When I first started, Molina really was only available in Kent and Montcalm counties. And as we get into some of the other slides, you'll see how Molina has grown really across the entire state. So as being in the state of Michigan, we're part of the Northeast region. Michael Kane is our regional sales director. And then we have the four of us broker channel managers handling various states, myself and John in Michigan, Luke in Illinois and Wisconsin, and Michelle in Ohio. Our next slide here really talks about the Medicare footprint of Molina and some of the expansion counties there. We've added 7 counties this year, 2023, where our products are available in. And so now we're at basically 56 counties in the state of Michigan. Our next slide here demonstrates what those counties are in the teal blue. Hopefully it's teal. To me, it's teal. It may be something else to you all, but for me, the teal in the dots, that shows where all of our plans are available in the state of Michigan. And then in kind of the orange mustard color, those are the expansion counties where our plans are available for 2023. We did have a service area reduction in 2 counties, Berry and Mason. They are no longer in the service area. However, as you can see, Molina is really growing and becoming more and more available to not just the D-SNP population now, but also those who would qualify for regular HMO or MAPD products as well. Okay, so the Molina difference. This slide here demonstrates basically how some of the supplemental benefits that Molina offers are accessible to our members. Okay, most of our plans will offer things like dental, vision, things like that, over-the-counter items. But it shows the My Choice card, which all of our members receive. The way that card works, if it comes to the over-the-counter, the dollar amount is automatically loaded onto that card depending on the plan that you enroll in. There's four plans. And then the other what you might call SSBCI, those are loaded onto the card based on whether or not the individual qualifies for those things. So food and produce, the other SSBCI benefits, which are genetic testing, pet supplies. If you have a service animal and you need to feed them, you can have money loaded onto the card for that. And also for mental health and wellness, things like maybe you've heard of Calm, certain applications that you can use in order to assist with personal mental health and wellness. Transportation, especially with our D-SNP products, Molina offers free transportation to any doctor's appointments specialist eye care, dentist, and pharmacy. And so it just requires 3 days notice to make an appointment for those rides. Molina will have someone pick you up and bring you back. In the case where access to care, the vendor for the transportation, is booked, Molina also has made use of vendors such as Lyft and Uber to get our members to their appointments. So now we'll get into the plans a little bit. This is kind of a high level view of the plans. The first slide is our D-SNP products. We have a full dual and we have a partial dual product. So the 001 and the 005 products are for those individuals. So both of these, or excuse me, the first full dual product you see here on the left has no premium. There's no copay for the specialist or primary care. And as is true with most full duals, they don't have any out-of-pocket responsibility when it comes to primary care or inpatient hospitalization. For the dental, we give a $4,000 allowance for comprehensive. For preventative things, x-rays, cleanings, we do those things and it does not count toward the $4,000 allowance. So that $4,000 isn't touched until the person starts to use it for more comprehensive things. We also offer a fitness benefit through Silver and Fit. Okay, so if you go to the Silver and Fit website, you can actually type in the zip code of the member, or the member can do that, and they can locate gyms in their area that they can go to, and Molina will actually take care of the membership dues for that individual each month. There's a hearing benefit. We'll do a hearing exam and up to 2 pre-selected hearing aids each year. Of course, the person has to do the hearing exam, and once it's determined that the person needs assistance with this, Molina will pay for hearing aids. I think there's 10 or 12 on the list of hearing aids. In addition to that, we offer meals through Mom's Meals or Nourish Care, up to 56 meals. If a member is hospitalized and perhaps released and they're not able to cook for themselves, then Molina will provide up to 56 meals. I've actually seen them double that on a few occasions, where even after that, the person still needed assistance and Molina provided another 56 meals for that person. Again, transportation is there. And this next one here, if you can see that, in-home support services through Papa Pals. This is a really great benefit. It's available on all 4 of our plans. The Papa Pals it's not just in-home companionship. This is something that is available to members if they need assistance with household chores, cleaning, laundry, and things like that. There are some limits to those things, but that service is available where they can actually have a person come into their home, and even if it's just to talk. Some of our members, especially with COVID, they've been detached from family and friends and things of that sort. So to be able to have a person come in and just talk to them is really a good thing. So 90 hours for the full dual product. And they also will assist with driving the member to places they need to go. So the transportation is strictly for medical. That's inherent in the plan, the transportation benefit. But through Papa Pals, even if it's a trip to the grocery store or any other place, Papa Pals will actually do that for the member as well. For the vision benefit, we give a $350 allowance every year along with a routine eye exam. That's on both the full and partial dual product. And then when we look at the over-the-counter benefits, there's a $370 and $365 allowance respectively of in the Complete Care Select. So the full and partial dual product, they have a large amount of over-the-counter allowance to use. There's no rollover with that. They have to use that or they'll lose it. and they can obtain those benefits by calling and placing an order over the phone, online through nations.com. They can place an order that way, or in person using the Flex card that's available to them. There's a food and produce allowance, $32 a month for the full dual, $40 for the partial dual. They do have to qualify for that by means of an HRA and an assessment by a case manager. Every member that enrolls in Molina's products, Molina reaches out to them with a case manager, and that case manager can help determine what SSBCI benefits the person qualifies for. They don't need anything from the doctor. They don't need any note or anything to qualify for any of the SSBCI benefits. Food and produce, basically what I've seen is if there's any health condition that can be that can basically be helped by a good diet, that triggers automatically the food and produce benefit. The other SSBCI benefits, they look at more closely as far as, if you have a service animal or you need an exterminator, they may look more closely at that to see if the person qualifies for that benefit. One thing that isn't mentioned here that I probably will add is the emergency personal response system. We've all heard maybe I'm older, but the I've fallen and I can't get up commercial. Molina does offer a personal response system for individuals, and it isn't necessarily just for emergencies. Even if you just want to talk, you can press the button and you can have a live person just get on the line and talk to you about anything that you want. So that's available. Again, the case manager would weigh in on that to see if the person is really eligible and qualifies for that benefit. Now, moving over to the HMO or MAPD products, the 006, 007. Again, I won't get into line by line here. One of the differences is you'll pay a $20 copay for the specialist for that. For the prescription, there's no deductible in tiers in tier 6, but tier 1 through 5. You'll have to have a $125 deductible for that. The Part D Senior Savings Program is something that we know that the government is required everyone to do. And so we've got the $35 insulin maximum each month for insulin that's in the prescription drug formulary. In the 006, there's a $2,000 allowance for dental. It works the same way as the others. The preventive services, cleanings, x-rays, things of that sort don't count toward the $2,000 allowance, only when you get into the comprehensive care. There's a fitness benefit, hearing aids, meals, transportation, 90 hours of in-home support, and then eye care. They give you $200 for eyewear every year. And then for this, we also give you an over-the-counter allowance of $90 a quarter. Food and produce is $45. And then the other SSBCI benefits are capped at $150 per quarter for each of those. And then this is a new one for us, the Molina Medicare Choice Care Select, the 007 product. This is our buyback product, which I think is the highest in the market, $105 buyback that gets put back into their Social Security if they're not receiving any type of assistance from the state. So they can't be getting extra help or LIS or any levels of Medicaid or anything of that sort in order to qualify for that. So if they're not getting assistance, they would qualify for the $105 buyback plan. There's no premium here. You can look through there and see there's a $0.50 on the PCP and specialist. There's a $375 deductible for prescription tiers 1 through 6. And then for this one, we don't offer dental, hearing, meals, or the transportation for this particular product. So this is for, you might consider veterans, those who may perhaps already have some type of dental benefit that they're using, or you know, maybe even implants that they have already, and they would not need things like dental or some of the other things, or will be able to pay out of pocket for some of those other items. So however, it does offer, $100 over-the-counter allowance every quarter. So from the catalog, they can order, they can go in person. Actually, there's a form you can send in to place an order that way, which is not a highly used way, but it is available. Now, as far as network goes, we go back to the network. These are some of the highlights: Trinity Health / St. Mary's, Beaumont Hospital, which is now they've merged with Spectrum Health to form Corewell. So the plans are available at those hospitals, Ascension, on down the line. So right now we're working on Borges and Kalamazoo, but also Spectrum Health does not take our MAPD product right now. They are in talks with them to see how we can get them on board with the non-DSNP products that we offer. And actually, I think next week we'll be in on another meeting with them to see what the progress has been as far as that. But once that happens, as you can tell, it would be very difficult to escape the network here with Molina. I mean, there's a couple gray areas there in the state, but overall, the most highly populated areas of the state, you can get service in network with Molina, and it is an HMO. All right, so back to the additional benefits that you can get, not the over-the-counter, the SSBCI benefits. Once a person enrolls in the plan, they do have to complete an HRA. Molina will pay $100 for each HRA that is completed for the member, for members, $100 per member. And basically what Molina will do will they'll assign a case manager to you or to the member to determine the level of help that they need in addition to what's inherent in the plan already. Once they receive the card, they do have to activate the card and create a PIN number. Once they do that, they're able to check the balances on the website, or they can call and see what's available as far as the balance, or even food and produce. You can order some of the things like canned goods can also be ordered online. And once the card is activated, they can make use of some of those things. And then we have our broker resources here. You can call to get contracted with Molina. You can call to do an enrollment, get a telephonic scope of appointment, or do the entire enrollment telephonically. And the way that CMS requires those things to be done right now. And there's the main number to do that. And you can also call to check eligibility to see what plan the individual qualifies for. Then what we call the MAC, the Molina Agent Center, is a nice resource for agent trainings. Every time we do a training, whether it's product training, whether it's how to do a needs assessment, there's all types of trainings. How to use the DRX tool to do an online enrollment. You will find those trainings here along with other valuable resources for our broker partners. So we encourage you to look at that site and see what's available. If you're not contracted, this slide here helps you see how you can get contracted with Molina so that you can offer this in your portfolio, help you grow your Molina or your Medicare book of business. And of course, this can be sent to anyone who needs it. And then here we see various sites that are available for use for our broker partners, the provider search tool, where you can see what hospital systems are in network, or even individual doctors, PCP specialists, the formulary lookup tool, helping us to see what medicines are in the formulary, which require step therapy, prior authorizations, things of that sort. The MAC, which is the third one down, and the Molina broker portal, which our broker partners can look at to see commission statements and things of that sort. So nice resources there. How to enroll members. We can do the paper enrollments with an enrollment kit. We can do an electronic enrollment through DRX. And we can show you how to do that. There's trainings on doing that. The nice thing with the DRX program is that you can actually send the application to the member for them to complete on their end, including the scope of appointment. So when they complete those, you instantly get a message saying that the individual has completed the scope of appointment and or application, and it's in processing. Then of course, again, you can call and you can have the enrollment recorded on the recorded line. We won't go over the special election periods. We all have a good grasp of that, hopefully. If not, we can do a training on that. And then here are the member service numbers for the states that Molina's Medicare products are in. And this again can be sent to anyone who would like to add Molina to their list of offerings. So thank you. I won't take any more of your time.
Well, thank you, Javon and Jonathan, and thanks for sharing all that valuable information with our agents today. We really appreciate it, and we appreciate the growth that Molina is having in the state. And let's see if there are any questions in the chat. So we have no questions. Our next presenter is going to be Blue Cross. And Nicole, are you on?
Yes, can you see me and hear me?
I can see you. Okay, and are you able to share your screen? Molina, you're still sharing right now, so.
Oh, okay.
Share. Yeah.
Stop sharing.
Okay, thank you so much. And for everyone that's on the call, again, we are recording this, so by Monday it should be up on the IAD website for you to view. Or if there's anything that you said, hey, I want to review that again, you'll be able to review the video and have access to the information. So you're still sharing?
Am I still sharing?
Yes.
Now my options aren't there anymore. I may leave and come back.
Let me stop, see if I can stop sharing. Let's see. So this is Nicole Wingate. She's the manager for Blue Cross.
All right, happy Friday, everybody. My name is Nicole. I've been working with the Blues for 15 years now. Time flies when you're having fun. Today we're gonna do a little quick review of benefit highlights. What's new for MedSub, because you know that's the time of the year. I also provided Pat with some great documents. I have a job aid that has options on how to order cards. So that's medical cards and OTC cards. We're also going to be talking a little bit about OTC because that's the hot topic today, nowadays. And I do have a flyer that is being sent to members as well. So you're going to check that out as well. And also I have an alert, and you might have seen this or not, but Pat has it. It's a document alert regarding our MedSub plans. It has a link with all of the documents in it for 2023. So updated documents and new link to enroll the DVH, dental vision hearing, online. So you don't have to fax it in or mail it in. You can do it right online as well. So let's get started with some quick benefit highlights. So these are all of our plans. We have 4 PPO plans. The Blue Essential, very popular. It's a $0 premium plan, and it's covered all 83 counties in Michigan. Our HMO POS plans, we have 5 of them. I would say Prime Value has been very popular as well. And then we have 2 local HMOs, which is the new local HMO and the Connected Care that's dealing with Ascension and Trinity hospitals. All right, let's talk about our PPO real quick. Some highlights here. Of course, with our PPO, you can see any doctor, no referrals necessary, in or out of network. We have 0 medical deductibles for all of our plans, which is huge for a PPO. 0 for a primary care physician. Of course, we have emergency and urgent care with all of our plans. and a zero copay for virtual PCP and behavioral health services. You see that is being more popular more and more. And it's very easy to sign up. You can actually do that with the mobile app. I do want to mention the vision allowance is in all of our plans, 150 for our PPOs and our hearing exams. And we also give hearing allowances for $750. This is our network. So if you live in the state of Michigan, at least 6 months out of the year, you qualify for our PPO plans. And then this is just our benefits at a glance here. I like this slide because it kind of just shows you some of your basic benefits that members are looking for. Again, we talked about the essential, which is the $0 premium. All of our plans include prescription drug coverage. Primary care physicians are $0. As you see, we have over-the-counter allowance. You get a card with that, $85 for the essential, Vitality Signature $25, and then Assure has that flex card. So it's one card that you get. It's an OTC for groceries and food items if you qualify, and plus you get that $75 for dental, vision, and hearing. So it doesn't have to be toothpaste or toothbrush. It could be for the dental visits as well. So anything dealing with dental, vision, and hearing, you can use that flex card. And remember, our OTCs are rollover. So if you don't use it, you can still use it. Maybe not funny, I don't know. I thought it was. Okay, so moving along.
That's great.
Now, our plans have included preventative dental already included with a base plan, and you get that $1,500. But if you need extra dental and you decide you need extra dental, you can opt for the optional supplemental dental and vision package. All of our plans have it. It's just additional $20.50. You'll get an extra $1,500 in and out of network dental allowance. Combining that will make it $3,000 allowance if you do choose this optional supplemental benefit. Remember, no waiting period, no dental deductibles, and it's a 25% in-network or 50% out-of-network co-insurance. And it also includes the vision there, as you see. So let's talk about our HMO POS, quick highlights. As you see, a lot of zeros, zero monthly premiums for all plans, zero monthly premiums for some of the plans, zero medical deductible for all of the plans, zero PCP office visit in network, zero prescription drug deductibles, all plans as well. So that's huge as well. And of course it has the vision, 150 that they give you, and emergency and urgent care worldwide. So we're in 70 counties as our service area for our HMO. You choose a primary care that coordinates your care, but referrals aren't necessary to see in-network specialists. This is our HMO plans at a glance. We have our now popular Prime Value, which is a zero premium, no matter what region you live in. All of our plans include prescription drugs, except for Elements. Remember, that is a $0 premium plan, but for somebody who has maybe VA insurance that use their prescription drugs, they can pair it with this Elements plan and still get all of the bells and whistles that Blue Cross Blue Shield offers. The over-the-counter allowances look great, $85 for the Prime Value, $50 for Elements, $25 for Classic and Prestige, and then our community value has $100. And remember, that's rollover. Zero medical deductibles and the out-of-pocket maximums look pretty low there. Now, you can also add the dental vision buy-up for $20.30. No waiting period again, dental deductible. This will give you $3,000 total across the board if you do choose this, and an extra $400 for vision when you combined it. And we have the two local HMO plans. This is our connected care. It's been a while. I've been here for a while. It's a balance between cost and coverage. It's $58, zero medical deductible, includes prescription drugs, preventative services, as well as all of our plans. And it has that over-the-counter benefit as well. We're in 11 counties, and this is a designated network of doctors and hospitals and care providers who use Ascension and Trinity Health. These plans have emergency and urgent care worldwide. So if they're traveling, but don't travel that much, they may want to look at this plan. And this is our new local HMO plan. This kind of mirrors Prime Value, but it's only in 3 counties: Wayne, Macomb, and Oakland. And it also has with the Trinity and Ascension hospitals. So as you see there. It also has the buy-up for only just $20.30. And the good thing about this buy-up is if you need it for this year, but you don't need it for the next upcoming year, you can always drop it. So these are some of our innovative programs to support members' health and happiness. We talked about our OTC card and our Flex card with our Assure plan. We also have Pop-Up Pals. And as that was explained earlier for Jonathan, I believe, we also have Senior Link, which helps caregivers. Very personal to this because my grandma is 99 this year, and she's, my auntie takes care of her, so she can really, really take advantage of the support that Senior Link gives everybody. And this is new for 2023. It's actually available for all MA plan options for Blue Cross Blue Shield. We also have meals and transportation, 28 meals, 14 days, discharge, purse management. So like if you're just coming out of the hospital, transportation as well. This right here, so I can see this. Transportation, 1 round trip for annual wellness visits within the calendar year, no referral needed. Okay, well, we have some new Medicare supplement information that I want to share. And this is just quick highlights over it. I'm just going to jump right into it. So our dental, vision, and hearing package this year is $17.25 a month. Went up $2 because last year it's $15.25. So it is going up $17.25 a month. New members can add the package to their Blue Cross Blue Shield Medicare supplement plan at the time of enrollment, or having, if they're doing their application, 30 days or to their effective date. So within that 30 days, they can still send in that DVH application. Now, current members can add their package to their existing Blue Cross Blue Shield supplement or Medigap, legacy Medigap plan between February 1st and April 30th each year. The dental, vision, hearing package coverage begins on the first day of the month following after the enrollment form is received. So eligibility, they must be active in a supplement plan or legacy plan. Now, we still have members in our My Blue BCN plan that is kind of discontinued, but for those members, they can still be in that plan as long as they pay their premium. That is not included, this DVH, for those members. Only the Blue Cross Blue Shield Med Sub or Legacy Plan members. And individuals must not have dental, vision, hearing coverage through another individual plan. Also, members can enroll in this Med Sub DVH. They have options. So when they're rolling and submitting, so you as agents, if you're submitting this enrollment in February, you have an option of when the coverage starts. It can either be March 1st, April 1st, or May 1st. So that's good information there. This is just more information about the dental. You see 0 deductibles, 0 co-insurance, 50% co-insurance for out-of-network. Vision, you get $300 allowance for frames, and hearing aids based on the hearing aid choice. Those are the options there per ear. And then we go through VSP for eye care provider. So the number and the website is below. All right, let's talk about this discount. Household discount went up from 5% to 10%. So if you live in another household with another Blue Cross Blue Shield Legacy Medigap or Medicare supplement member, and you pay a monthly premium, you can get a 10% premium discount on each of the members' bills. So that's amazing. Now, you don't have to be family members at all. So there's no requirements there. You just need to live in the same household, and members must apply for this and be approved for the discount. So you don't automatically get it. So you definitely have to be approved. And if members are approved, then the discount will be going the rate each month. They'll have that 10% discount. So the members that have the 5% now, that's going to change over, and it's going to be 10% as well. So this is new current members and new members as well. We also have the 24-hour nurse line, the Blue Cross Blue Shield virtual well-being, which are virtual webinars, and the Blue 365. No matter what plan you have, group, individual, Medicare, MAPD plans, everybody have access to the Blue 365 website. And I know a lot of people like silver sneakers, so a good thing to mention is that the Blue 365 have discounts on fitness. So I think it's $25. You can go and work out at facilities, kind of similar to our silver sneakers in our MAPD plans, but just $25, and they can go to a network of facilities like different gyms. So a lot of discounts there just by showing your card. So I definitely encourage you take a look at that so you can share that with some of the members and your clients. So I do have a couple of flyers to show you and some other things that I provided to Pat here, but this is my information in case you ever want to call me. I do well with email. Text is good as well too. So just jot that down, but also if you can't get in contact with me, get in contact with Pat and she'll get in contact with me as well. Okay, so I'm just gonna jump out of here and then go to this alert. Now you might have seen this if you're registered with us for our agent alerts. As you see, it has all of the documentation for our med sub plans updated for 2023, enrollment kits, the vision dental hearing kit, sales fold out, all of those great documents are right here that you can access to through bcbsm.com. And then in the search tab, you can put in one of the documents that you're looking for, or go to the bottom and hit documents and forms. You can search for that. That information will pop up as well. So it's different ways that you can do it. But also, most importantly, it talks about the things that we just talked about, kind of going over about the 10% discount, $17.25 per month for the dental, vision, and hearing. And now new, we added the optional dental, vision, hearing package as existing members can use this online application. So our agents could do this as well for our members. So you just don't have to just fax it in or try to mail it in. I don't think anybody mails in the application, but you can just click that and just put in the information for the member to be enrolled. And then I have one other thing that I want to show you here. This is something that I provided to you, Pat. It's our OTC flyer. Mm-hmm. And this is pretty cool because it kind of gives you a sense of what's covered in our OTC. As you see, batteries, diabetes care, first aid, just to name a few. And it goes on there with food and beverages. Now, to qualify for our food and beverages, you must, the member has to be diagnosed with one chronic condition like diabetes or hypertension. CMS mandated this for this year. Before, it really didn't have any constrictions, but this year you have to have at least one chronic condition to get the food and beverage for our OTC. And we saw that 70% still qualifies for the food and benefit, so it's not that much disruption there. But again, great flyer right here, talks about all the different things that you can get, just gives a sense. Members can also go to participating retail stores, CVS, Dollar General, Kroger, Rite Aid, Walgreens, Walmart. And it also talks about items that are not covered, like grooming products or cosmetics. They should have added pack of beer, because I get that question a lot. Like, no, you can't get that.
Right, right.
Right. And so, yeah, really good information here. I also gave you a job aid, Pat, on how to order member ID cards,
Sure.
different options, and then also OTC cards. Right now, the vendor is kind of overwhelmed, and I've been hearing that from other carriers as well. But you can order a different one, a different OTC card if needed. And I gave that to Pat, so she can definitely share that.
Yes.
So I think I'm done here, and I can answer any questions that you guys might have. Kind of stopped a little early to, it's Friday, give you some of that Friday back.
Yes. Well, I'm going to start it off, and we're going to open it up to everybody for Q&A. But you mentioned the Senior Link program. I wanted to, understand a little bit more about that. Does the member get a certain amount of hours or days in their plan? How does it all work? It sounds fantastic.
Yeah, let me pull that back up here. I just added it as we were talking right before I went on. There it goes.
We get a lot of members who need in-home care, so if they can get something in addition to the Papa Pals, that's awesome. So
yes, I forgot to share. Let me share again. Okay. Yeah, so with the Senior Link here, and I'll make it, not from beginning for current side. There it goes. This provides supports for members, communities. I've heard a story that a veteran needed a ramp. So they hooked them up to the right people to get that ramp covered for the caregivers, Senior Link here. And they just, depending on where you live, they look in those areas for resources to really help and meet the needs of that particular person.
So this is not necessarily just in-home care. It's whatever that member may need. They try to find a resource and provide it. Is that correct?
Yeah, so it's a little bit different from like Papa Pals. They have the wellness support, transportation, grocery shopping, light housekeeping. This is more support for the caregiver.
Okay.
Resources that help them get the things that the members really need, and to help support them, because it's hard. It's hard.
That's awesome. Okay. And someone asked, is the fitness fee $25 a month if you want to have a fitness plan?
Yes, for $365, I believe it's $25. It might be $29. I gotta look again, but last time I looked, it was $25. And it's a network of facilities that they can go to, similar to Silver Sneakers, where they can go to and work out. And I think like LA Fitness is in there, because I really love LA Fitness.
I like LA Fitness a lot too. Yeah. So yeah, okay, great. Any other questions for Blue Cross? Let's see. Okay. So we're going to open it up for general questions. Thank you so much, Nicole, for sharing some really good information with us. I know we get a lot of Blue Cross questions all the time, and so you answered a lot of them. For everybody that's on the call, the flyers and things that you shared with us, I do have those in an emailable version, so I'll be sending them out after our webinar today. So people will have access to them and can use them in their day-to-day operations. So any other questions? So I just have one other question, and I'll throw this out to the panel. What kinds of places would you suggest that agents go? I know our agents tend to have a lot of referral business, and some of them already have a nice book of business. But if they're looking to grow their business, specifically with D-SNPs during this time of year when business is slower, any idea about what kind of places they should be going to?
Yeah, I'm already not muted. Okay. So food pantries, I was in sales with Molina up until a few months ago. I spent a lot of time in food pantries. Feeding America, I found out where the truck was going for Feeding America, and I met those trucks there where food was being delivered. Low-income housing, I would go in there. Grand Rapids has several high rises, 6, 7 floors. Well, that's high rise to me. On your side of the state, they may not be high rise, but I went to a lot of those places in the community room set up. So yeah, that's where I spend a lot of time, is low-income housing, food,
Okay.
Food pantries.
Thank you, Jonathan. I'm sorry, Javon. I want to call you Jonathan too. Thank you, Javon, for sharing that great information. Anybody else want to chime in on that particular question? You could just unmute yourselves and speak. So
yeah, I would say senior apartment homes or senior housing places would be. And because I didn't talk that much, I just kind of wanted to tell all the brokers on behalf of the carriers on the D-SNP side that really, in order to grow your business from a D-SNP standpoint, you really need to be out in the community. I know that's the Molina way. It just seems like that would be just for the product. You got to be out in the community,
yeah,
because you can lean on let's say marketing dollars or leads, but that's not sustainable. Really, what's sustainable is creating those relationships, or those community-based relationships. So I encourage all the brokers on the call to really do that. So
okay. Yep. So get out in your community, do some community events. Anybody else want to chime in on that particular question? Yes, no? Okay.
I was just going to echo, I'm sorry, Nicole. I think we're all probably going to echo each other, but yeah, just echoing what Javon and Jonathan both shared. You really do have to go to where your D-SNP beneficiaries are versus waiting for them to come to you. So finding those senior apartment complexes, community centers, food pantries, making those connections. And then I'd also encourage you all to connect with the people that volunteer at those locations. So don't just try and connect with the beneficiaries, but work with the folks that volunteer, the folks that run those programs, because they're going to be able to connect you with a number of other D-SNP resources and resources with, I just said resources twice, within the community. So that's definitely what I would advise you all to do.
Yeah, that's great information, Emily. Yeah. And so the other thing behind that is a lot of our D-SNP members may not have transportation. So that's another reason why sometimes we have to go to them and maybe, go to a church in their area where a lot of the D-SNP members may attend. Maybe they have transportation to get to church, but they can't get to an event where you are. But if you're at their church on a Sunday or Wednesday night or whenever, that's a place that a lot of our D-SNP members can get to and do attend. Anybody else want to chime in? Nope. Okay. Are there any other questions on the call? Not at this time. Any other comments from our carriers? Anybody else would like to have any last words? No? Okay.
No, just thanks for having us, Pat.
Yes, I want to thank everybody on behalf of IAD, our leadership team, and myself. It's been a great time spending a Friday morning with everyone. I hope everyone on the call, our participants and attendees, learned a lot. And, if you have any questions, you can reach out to myself here at IAD. My direct extension is 128. And, this webinar will be uploaded on our website. And for anybody to view it, or if you need to review some of the things, and I'll be sending out some of the documentation that was shared today. So if there's nothing else, I'll give people back some time in their Friday. Thank you all again to WellCare, Blue Cross, Molina. Thank you so much for sharing with us today, and we look forward to seeing you in the future.
Bye.
Everybody.
Have a great weekend,
Bye-bye.
everybody.
Thanks, everybody. Have a good weekend. Bye-bye.
Bye.